Dr. Noa's YouTube updates, and what I try to do every week is go through the scientific literature and show you the power that natural medicine has, whether it's vitamins, minerals, amino acids, herbs, botanicals, whatever you want to call them, very powerful. And as I always do, I cite scientific research. These are actually from drug journals, and so once again, that becomes some of the frustration. Is like I always hear that, well, how come my drug doctor didn't tell me that? I don't know. I don't know what he or she's reading. I mean, you're not going to read it in Golf Digest or Forbes and stuff like that. You have to read the scientific literature to see, what's out there. So in this article here, from South Africa, published in Nutrition, July and August of 2011. Right now, micronutrient supplementation linked to decreased mortality among critically ill. This shows you the power. There's at least 4 scientific studies, and this is a tragedy. I just had a friend and colleague who had a stroke and was in the hospital, and the garbage, maybe the registered dietitians do their best, but boy, I mean, you would think they would be on cutting edge nutrition. It was garbage. Well, in this study here, go back to my statement, there's been 4 scientific studies that people go in to the hospital, come out malnourished. So that's how bad the food is. So here's something, physical stresses, usually people are there because, they've had some type of disease, they've had some surgery or all. Those are man-made induced type of stresses like that. They need the best nutrition, like a top athlete does, but they don't. They unfortunately get marginal at best. Now, quote, they're getting better. It's just not like Jell-O and some type of canned peas and stuff. But still, the quality of nutrition that can be done in there could be incredible. So in this article here was a systematic review of 15 randomized controlled studies showing that when people are given micronutrients at adequate levels, the review does suggest potential benefit of micronutrient supplementation in critically ill by possibly associated with decreased mortality. So yeah, you give these nutrients, less people die. I mean, that's how powerful this is. The next study that we'll talk about is alpha-lipoic acid in the treatment of diabetes mellitus, type 2 diabetes. Alpha-lipoic acid is a very, very unique type of natural nutrients, and antioxidants it's fat and water soluble, so it kind of goes into some places in the body where water soluble can't go into fat, and fat can't go in because water and fat or lipids can't mix like that. And one of the things that I've helped quite a bit, what's called peripheral neuropathy, especially diabetics, as they get more sick. Remember, type 2 diabetes is 100% curable because it's a lifestyle and type of disease, but we don't want to confuse that. Here, take some hypoglycemic agent and pretend it's going to get better. It doesn't. Oh, that doesn't work. We'll give you some insulin. Oh, that's right, that doesn't work. And we'll just start amputating your legs, and you go blind, and then you eventually die. Very, very sad, but it makes lots of money. So alpha-lipoic acid is a wonderful type of nerve tonic of sorts that helps kind of protect the nerves, because when diabetes levels get out of control, that high sugar content actually starts to kill lots of different things, but in particular the nervous system. And that's what that burning sensation is. Your nerves are actually dying. They're screaming out, help me, go see Dr. Noa, not the drug doctor. And so that's why this particular type of nutrient has been shown to be very, very effective, as well as some other nutrients in terms of having peripheral neuropathy. So in this, once again, this article here from Saudi Arabia Medicine Journal, June 2011, they know that, so that's kind of interesting. Follow up on that in terms of antioxidants, and we'll talk about the next break here about another type of NRF2 activator, antioxidant supplementation in type 2 diabetic retinopathy. So diabetes is just, being that it's so curable, what a devastating disease. 40% of every dollar spent on diabetes, it's an epidemic, it's getting worse. It's just tragic. Well, it's the #1 reason for blindness. So in this article here from Spain, and it's published in, Ophthalmology, December 2010, a couple months ago, showing a 5-year follow-up of antioxidant supplementation in type 2 diabetes. Oral antioxidant supplementation could be a useful adjunct long-term therapy in the treatment of basically this blindness type of thing. So over and over again, and I just had a patient come in. The drug doctor that my patient went to said that these nutrients are expensive urine. No, the only thing that's expensive is going to you, a quack, who doesn't know about these things. So it's very, very sad to see that. And the last one we'll do, which was one of Cindy and Don's favorite, CoQ10 reduces oxidative stress after supra maximum exercise. So when you exercise, yeah, it's wonderful. It's a part of good health. You have to do it, but it's like revving up your car. As you exercise, your oxidative stress starts to rise, and so you have to have something that neutralizes that to be able to bring that back down. And we'll talk about in the next segment here nerve 2. But in this study here from Turkey again, published in Journal of Sports Medicine, Physical Fitness, June 2011. Once again, cutting edge, 2011, not 1942 from when you go see your drug doctor talking about how vitamins are bad or this drug is really good. Let's get up to the current status like that. States that lipid peroxide and antioxidant defense increases after repeated short-term exercise. So it doesn't matter if you're doing Pilates, you're running, biking, great stuff, you got to do it. That increases oxidative stress. If you don't reduce that, you have this, once again, noxious type of things like that. And CoQ10 can be basically partially prevents these increases. Now we have something that works way better in terms of actually working on this nerve 2 in terms of reducing oxidative stress by actually activating the enzymes, which is an indirect way versus direct where you take CoQ10 or blueberries and stuff like that. So keep happy. I'm glad Cindy liked my little joke earlier on like that. That was great. And I'll talk to you soon. Thanks.